Next, going to the what are the structures or the relations of the mediastinal surface of the right lung. So when we go to the right lung, hold in the anatomical position, this is the anterior border and you have the mediastinal surface, and in this mediastinal surface we are going to get the relations like here you have the relations, the anteriorly we have the right atrium. We are studying now the relations of the right lung. So right lung mediastinal relations are, here we have the right atrium. On the upper part here we are relation of the superior vena cava. Inferiorly we have the inferior vena cava. So inferior vena cava, here superior vena cava, here is the right atrium relations. On the other side here little laterally going to, that is the azygous vein. Azygous vein opens into the, that is the superior vena cava. Next, on the posterior aspect, we are going to have the relation of trachea and esophagus. Then one we get the nerve which is relating on the anterior aspect, that is a right phrenic nerve, and going posterior here hilum crossing right vagus nerve. So relations of the mediastinal surface of the right lung are, you have to explain the right lung related to the, here you have the right atrium, superior vena cava. You can see the marking of the superior vena cava, that is a combination of a right brachiocephalic, left common carotid relation. Here the inferior vena cava related totally, and here anteriorly we have the anterior phrenic nerve, that is a right phrenic nerve, and posteriorly here going, that is a right vagus nerve. So right vagus nerve is related. So other relations are here trachea and esophagus are related here, almost all in the mediastinal surface of the right lung. Going to the left lung, this is the left lung. Left lung mediastinal relations are the, here majority of this is related to the left ventricle. Left ventricle chamber of the left ventricle heart is related, that is the left ventricle. And above this we are going to have the relations the like arch of aorta and descending thoracic aorta. Arch of aorta, descending thoracic aorta. Here you are going to get the left brachiocephalic, left common carotid relations. On the here upper part which is relates to the trachea and esophagus. So both the lung which are relating, that is trachea anteriorly, posteriorly esophagus. Here also we have the trachea and esophagus, and we have the left phrenic nerve and left vagus nerve, and left recurrent laryngeal nerve is related in the left lung. So thoracic duct also related in the upper part here to the crossing the left lung. So that thoracic duct, left recurrent laryngeal nerve, trachea, esophagus, and I have told arch of aorta, descending thoracic aorta, and the left ventricle. So almost all these are the mediastinal relations of the left lung. So these you have to know and identify. Next, going to the most important part, which is the root of the lung and hilum of the lung. See here, almost all the root or the hilum. Root is a part where the structures enters inside and come outside this organ, that is we call as a root. And total root is covered by the one covering, that is the pleural covering, and which is making the descends downwards and makes the pulmonary ligament. Pulmonary word which is relates to the almost all, it is relates to the, that is the lung. So that pulmonary ligament is related here. And what are the root structures of the right lung? Here you can explain the root structure. We are going to get the eparterial bronchus. This is the eparterial bronchus, and this is a hyparterial bronchus. High. This is a pulmonary artery. We are going to get pulmonary artery, and this is a superior pulmonary vein, and this is a inferior pulmonary vein. So once again to revise, bronchus, that consists the two bronchus, eparterial bronchus, hyparterial bronchus, and pulmonary artery, superior pulmonary vein and inferior pulmonary vein. You are going to get bronchial arteries and all. So almost all this is surrounded by the pleural cavity, and this is we call as a root or the hilum of the lung. So this is a right lung. What right lung is consist? Up arterial bronchus. This is a high arterial bronchus, and we have the pulmonary artery, superior pulmonary vein, inferior pulmonary vein. So how to identify this is a bronchus? You can touch it, is a made up of cartilage, so that you can get as it is a hard structure. That is a bronchus. When you even squeeze, you are going to get the one which is air bubbles which are coming. That is from the that is a bronchus. When you squeeze, air bubbles coming from the bronchus, that is bronchus. When you touch and feel it, it is hard to touch because it is made up of a cartilage. So that right lung consists of arterial bronchus, hyperarterial bronchus, pulmonary artery, superior pulmonary vein, inferior pulmonary vein. We have the bronchial artery. So this is the root of the right lung. Then going to the root or the hilum of the left lung. So left lung consists we have the left principal bronchus. This is we call as a left principal bronchus, where you can identify that is bronchus, air bubbles coming. You can see air bubbles which are come from the bronchus, that is we call as a left principal bronchus. Now we are studying what are the root of the left lung. So left principal bronchus, and we have the here pulmonary artery. This is we call as a superior pulmonary vein, and this is the inferior pulmonary vein. So inferior pulmonary vein, superior pulmonary vein, and this is a bronchus, left principal bronchus, and this is a pulmonary artery. So pulmonary artery, bronchus, and vein. From above downwards, you are going to get that is the artery, pulmonary artery, and bronchus, left principal bronchus, and pulmonary vein. So you are going to get the superior pulmonary vein and inferior pulmonary vein, and this is a left principal bronchus, and this is a pulmonary artery. So these are the things you have to know in the root or the hilum of the lung. Mediastinal relations of the right and left lung, that is we have covered here. So what is the difference between right and left lung? When you hold the right and left lung difference, when you can, according to weight, you can weigh, that is you are going to get as 700 gram and 600 gram is left lung. Then you can tell the right lung is having that is two fissures. One is a horizontal and oblique fissure. Then left lung is consist of the one oblique fissure. Then going to the right lung, this right lung is having the upper lobe, mid lobe, lower lobe, upper, mid, and lower. Then we are going to get the upper and lower lobe, which is you are going to get upper and lower lobe in the left lung. Then going to the apex and base, almost all they are present above 2.5 centimeter above that is a medial 2/3 of the clavicle. So that is you have to mention. Then what are the relation point that also differentiate in the lung? That is you have in the root of the lung, epiarterial bronchus, hyperarterial bronchus in the right lung, one pulmonary artery, superior inferior pulmonary vein, that is in the right lung. Going to the left lung, when you go to the left lung, you have the one bronchus, that is the left principal bronchus, and this is superior pulmonary, that is a pulmonary artery, and superior inferior pulmonary veins. So superior inferior pulmonary, these are the superior inferior pulmonary veins, and you have the bronchus, this is epiarterial, hyperarterial, this is the left principal bronchus, and we have the pulmonary artery, and this is the pulmonary artery. So pulmonary artery, you are going to get bronchus, left principal bronchus, epiarterial, hyperarterial bronchus, superior inferior pulmonary vein, superior inferior pulmonary vein. So this is the difference. So in the right lung, in the relations, mediastinal relation, related right lung, right atrium, you have the right atrium chamber of the heart related. Here you have the majority of the left ventricle. So left ventricle is related. Both the lung relations, you have the trachea esophagus, and the azygous vein opening into the superior vena cava relates to the right lung, and thoracic duct is relating to the left lung. So you have the 10 bronchopulmonary segment in the right lung, 10 bronchopulmonary segments in the left lung. So this is all about the difference between right and left lung includes. So this is what about the, we have studied the right. To hold the anatomical position, you have to explain the lung as a introduction. I have told introduction, and what are the appearance, spongy texture, that you have to explain. Then you have to explain the what are the lobes and weight of the lung. Then why it is a mottled blackish color, because of the deposition of this all polluted air where we inhale, carbon particle goes and on the lung parenchyma they deposit and gives appearance that is a blackish. So we call as a black mottled color. Then I have told the external features of the lung, as it is having the apex. Above I have told the medial 2/3 of the clavicle, 2.5 centimeter above the clavicle it is lying. Then we have the base separating from the base of the lung to the, this is right lung, so right dome of diaphragm. Then we have the left lung, left dome of diaphragm, and which is semilunar, and we have the inferior border. So anterior border, in the difference also you can straight anterior border in the right lung, and left lung is interrupted, that is forming the cardiac notch and lingula. One more differentiating point is lingula is present in the left lung, cardiac notch is present in the left lung, but in the right lung, lingula, cardiac notch is absent. So that you have to know. So in the general features of the lung, external features of the lung, apex, base, anterior border, posterior border, inferior border, medial surface, costal surface, then mediastinal, and we have the, that is a vertebral surface. Then I have told the mediastinal relations. Then I have covered the, what are the structures of the lung, that is the root of the lung or the hilum of the lung. This is all about the, briefly we have dealt the lung.